look up. At least this is what we saw the other day. Maybe it's a little bit better than before, but it's quite limited, okay? Good. So this is what we want to change. This is what the bridge technique is for. Lie down on your back, bend your knees, get down, arms together. This is what I explained before, okay? Arms here, and my hands are going to go at C7, T1, whichever segment that is not moving well. Like that. Now, notice that your elbows have to be a little bit to the side. Yeah? Your fingers are around the spinal process of C7 or T1. You can be here, but I prefer to do it sideways, like this. Then I can control the position of the head also. I'm not pushing the head. So with my fingers, I pull towards me first. I palpate and I pull C7 or T1 or whatever I can get hold of towards me, cranial. That's it. My thenar eminence is protecting against extension at the upper cervical spine. Because if they were not here, and when he extends, this will jam, this will compress, and we don't want that. The same here. This way, you ask if it's okay. You pull with your fingers, and then you say, push down into the table and lift your chest up. This is the movement. And back. I try to follow him all the time, not a jerky movement. You try to be there all the time. Okay? The middle of my hand is stiff. So to not allow too much movement at the mid-cervical spine, because this is what we want to minimize. Okay? Otherwise you will move here. Lift again. Lift. Keep on going. When he gets to the end, it's important that you really push it up. You really want him to get to the end of it. Okay? Some patients, when you get up here, lift up, they don't understand they have to let the head go. So they try to protect, to keep the head flexed. So tell him, let your head go backwards more. That's it. And back. Repeat that. As long as there's no pain, it's okay. It may look like, lift up. It may look like that I'm pushing him with my chest. I'm not. Okay, it looks like. Back. Once you have done a few of these, you retest the movement with extension. Sit up, usually on a chair, but wait a minute, wait. Yeah, look up. And you are looking if there's a change. Let me have a chair here quickly.
Стульчик дайте быстро.
The next thing you do. Now, you have mobilized the area. So you've done the bridge. Sometimes you have to do your reverse neck instead. Or combine these two. Okay? To get some movement here. The next step is to guide his movement. So mobilize, guide. Okay? So if this is mobile now, I can just put two fingers at C7 or T1. These fingers are going to be at the mid-cervical spine. One of these fingers are going to be in contact with occiput. Because when he extends to the end range, he will have difficulties getting back. And that finger is going to push his head up towards the ceiling to help him get back. So it looks like this. You get close. Put two fingers here. They're not doing much. They are just emphasizing, I want you to move from here. Sometimes you will push them as a glide. Okay? You get close. This is part 2 of the bridge technique. Okay? Now I ask him, look back. And keep your eyes open and keep on going. And back to the middle. When he gets back to the middle, I push with my fingers. Do it again. So now he's learning the movement. Okay? Again. Sometimes you may want to move your fingers around to get the best result. So if this doesn't do it, you may move to the rib cage, down here or down here. It may be part of the problem. Okay? So bend back, and lift up. Then try it again. Then you can see if you can do it. Okay? Then you give him the exercise. The exercise is basically 2 fingers behind occiput. Just 2 fingers is enough. You don't want to have the whole hand because it becomes stiff with movement. So if you have only a couple of fingers, it's enough. Keep this straight, bend back as far as you can go. When you reach to here, you're going to push your head up towards the ceiling, but use the muscles to bring it back to the middle. Do it again. And boom. Usually this exercise is a 4 to 6 weeks exercise every day. Just do 5 few repetitions a day until the end result should be, just connect, the end result should be that he can bring his head back all the way, bring it back, no, extend the neck.
Голову наверх.
I'm just holding you so you don't.
Смотрим вверх.
All the way, and slowly back. So this is part of the body. Okay, that's it.